India is on a mission and it is looking to kick China out of the global supply chain. And in its latest move, India has kicked China out of its pharmaceutical industry. Hi and welcome to TFI English, the national socio-political analysis arm of the TFI Media Group. I'm your host Piyush, and in this video I will tell you how India killed two birds with one stone with the domestic production of APIs. Let's begin. When COVID-19 pandemic started gripping the entire world, Prime Minister Modi came up with a unique initiative, Aatmnirbhar Bharat. The purpose of the move was to reduce vulnerabilities on external sources amidst ruptured supply chains. The main target of the move was, of course, to decouple from China. Now, around 2 years later, India has managed a major breakthrough: self-reliance in active pharmaceutical ingredients or APIs. On Tuesday, Union Minister Mansukh Mandaviya disclosed that manufacturing of 35 active pharmaceutical ingredients had started in India. Till now, India used to import these 35 APIs and was more or less dependent on China for it. The minister said the 35 APIs are being manufactured from 32 different manufacturing plants. This will give a boost to Aatmnirbhar Bharat. The minister also said that the move will help India reduce import dependence in the key sector. Mandaviya said that the pharmaceuticals sector had given a good response to PLI scheme. There are a total of 53 APIs and the production of the rest of the 18 APIs is also expected to commence in India in due course of time. The 15,000 crore PLI scheme for the pharmaceutical sector was announced last year. The stated objective of the move was to create global champions out of India who have the potential to grow in size and scale using cutting-edge technology and thereby penetrate global value chain. 55 companies with some big names like Sun Pharmaceutical Industries, Aurobindo Pharma, Dr. Reddy's Laboratories, Lupin, Mylan Laboratories, Cipla, and Cadila Healthcare qualified for incentives under the scheme. The incentives will be paid for a maximum duration of 6 years to the qualified company. India is the king of pharmaceutical sector. Its pharmaceutical industry has been booming for the past several years. However, the import of dependence of APIs has been a cause of concern for the country. India has 90% import dependence for APIs that serve as raw materials in the sector. And to make matters worse, China is the biggest manufacturer and exporter of these APIs. Many Indian pharmaceutical manufacturers are dependent on Chinese companies for sourcing APIs. Now, it was problematic for India in two ways. Firstly, China made huge export gains out of the Indian pharmaceutical sector by supplying APIs to India. And secondly, India's pharmaceutical companies became vulnerable. With China, we never knew when the CCP would snap the supply of APIs to India and kill the booming industry in India. With deteriorating Sino-India ties and growing Chinese belligerence, there was an even bigger risk of APIs being weaponized by China. India, however, has managed to escape the Chinese trap. This effectively helps India retain the autonomy in the pharmaceutical sector. India's message is thus loud and clear. It will no longer depend on China and will actively pull itself out of all Chinese traps. With self-reliance in APIs, India has managed to reaffirm its position as a global leader in pharmaceuticals.